Good afternoon and welcome to Open Classroom. I'm Janet Gilla, the Director of Professional Development for the Brown School, Washington University in St. Louis. I am so excited that you're here with us today because we have truly a remarkable program. For our participants joining on Zoom throughout this program, we can't see or hear you. You're muted and your camera is disabled, but we definitely want to hear from you. The chat feature is enabled and you can please message us in with your comments and questions as the program goes. I'm super happy for folks joining us on YouTube. Unfortunately, we don't have a way to include your comments in today's program. I want to thank and acknowledge Cynthia Williams, the Brown School's Assistant Dean for Community Partnerships. She's here helping to moderate the chat. She's going to be curating your questions as we go. I'm going to try to get through this quickly, but we have so many cool things coming up at Open Classroom. I just want to mention it to you because you are invited. We're back on the air tomorrow. Atia Thurman is going to be doing a programming introducing community organizing. On Tuesday of next week, Dr. Joshua Lewa is going to be delivering a program on mitigating burnout in the current career space. And then we have a brand new, just added program on Thursday of next week. Dr. Ross Hammond is going to be presenting on modeling containment of COVID. I want to mention this is the first in a series of 3 programs we're doing related to the COVID vaccine. We have a program on March 17th specifically related to equity and disparities. And then on March 24th, we have a program related to the science behind the vaccine itself. So great conversations, really one of the most important things going right now. And I know our audience wants to stay informed. So with that, I'd like to get the program started today. And it's my great pleasure to introduce our special guest moderator, the Nydorf Family and Centene Corporation Dean of the Brown School, Mary McKay.
Thank you. Thank you, Janet. And thank you, my colleague Cynthia, for really being the foundation of our Open Classroom program. So panelists, you are so welcome here to have this critically important, timely conversation around vaccines and our regional response to the pandemic. And there's a lot that I could say about each one of you. And because your bios are so important in terms of what you bring to these leadership positions. But if the chat is any indication, you also have a tremendous amount of support from people that are attending that really are recognizing you as regional leaders in probably one of the most challenging times we've had in our professional careers. Certainly that has been true for me as the leader of the Brown School. So what I'm going to ask you to do is I'm going to do a quick round of asking you to first introduce yourself and then talking about where we are from your perspective in kind of vaccinations in our region. You can talk about success, you can focus on challenge, but make sure that the first time you speak that at least we get to hear who you are and your position. And then I'm going to leave the bios for that for our website and because you're extraordinary leaders in our St. Louis region. So Dr. Garza, perhaps you can go first, introducing yourself and your role. I feel like we know you because we see you in our living rooms, but please go ahead, introduce yourself and just give us a little bit of framing comments from your perspective.
Sure, be happy to. Thank you. Thank you for the introduction. I am the Chief Community Health Officer for SSM Health. I was previously the Chief Medical Officer, but really as a result of the pandemic, we created a position for a Chief Community Health Officer. And so that's been a good switch for me. In addition, as you mentioned, I work with the St. Louis Metropolitan Pandemic Task Force as well. And so that's really been my full-time job for like going on a year now. So that's been an interesting ride for the past 12 months. As far as vaccine goes, so the vaccine seems to be an ever-evolving story. So all the way back from, at the very beginning of this, when being asked, hey, when do we think we're going to have vaccine? Of course, we beat those estimates, so that's good. And then came the rolling out of the vaccine. So as most people know, it was healthcare workers first, and then first responders, and then the at-risk population. The challenge has always been and continues to be the amount of vaccine that's available for people to be vaccinated. And then anytime that you have a scarce resource you have to prioritize. Doesn't matter if it's vaccine or, anything else. And so that's been the biggest challenge. Specifically for the St. Louis area, and I don't think this is lost on anybody. We have a very large population for the state in the St. Louis metropolitan area, and that means we have a lot of people that have to be vaccinated. And so keeping pace with those populations is challenging. But again, the rate limiting factor is always going to be vaccine. Now, we do think there's going to be increase in production here in the next couple of months with J&J coming on board, Moderna and Pfizer. We do believe that we have the infrastructure to support it between healthcare systems, public health, FQHCs, pharmacies, you name it. So as soon as we can get more vaccine, we'll be moving through all of those priority populations. So I'll stop there.
So other thoughts from our panelists, so that we can hear your voice. Things that you're most focused on in terms of kind of elevating as opportunities for citizens to know about, other myths that you want to dispel. So Spring, you're vigorously nodding your head, so maybe you could go next and introduce yourself and hear your voice.
Sure. I am Spring Schmidt. I'm the Deputy Director of the St. Louis County Department of Public Health and the Incident Commander for Public Health for the COVID emergency for St. Louis County. So I think there are a lot of things. The vaccine supply certainly does drive it. And then we build infrastructure to make sure that we can meet the need that's available out there to make sure that we're ready to deliver as much as possible. So we set ourselves a goal that we could deliver 5,000 a week. We blew through that. We delivered 9,000 in 7 days last week. When we have the vaccine availability, you really have to have the infrastructure to get that out there. But you can't have a one size fits all infrastructure either. So it has to be something where you are looking at different modalities that are more appropriate, particularly for some of our audiences that are going to suffer barriers in trying to get to a mass vaccination event or something along those lines. So we work to have mobile services going to congregate living facilities, particularly for seniors, for those in disability communities. We'll be piloting homebound services tomorrow for those who are fully homebound, who cannot have access to a mass vaccination site. It's resource intensive. We have hundreds of partners. We have a wide variety of volunteers. I saw someone in the chat. I'm more than happy to send our volunteer information for you. We have over 100 volunteer vaccinators. We've recruited about 150 non-clinical workers. The vaccine delivery is difficult. It does have to be controlled to a certain extent in order to make sure that you don't waste a dose, that we don't have people standing around in line on the opportunity to get something and then potentially be turned away. So every time you make a choice, you resolve a barrier in one area and create a barrier in another. You can't ever forget that that's the case. So it is a constant battle to make sure that, okay, well, this solves this problem, but it creates a barrier for this group over here. How do I now mitigate that and make sure that I get to that? That has not gone perfectly or smoothly, not in the county or anywhere else in the country. We've struggled, okay, that did not work. Let's make sure that we pivot and do this. But you can't ever forget that the decisions that you make have consequences for someone else that can't access it the way that is easiest for you to put it up. That is a challenge. We try to listen to that as often as possible, but out in the community and stakeholders. It's also weird to do grassroots level community organizing in a pandemic because it just cannot show up to as many places as we used to before. So we rely on a lot of community stakeholders to keep us in the loop about what it is that we need to do and change while we're building infrastructure and hoping for more vaccine.
Right. We really appreciate that you sharing that information and also really having a visible leadership role in this. So one of the things you said, Spring, is that communication is so important. Messaging, anticipating concerns or questions. And so I wonder if I saw Dr. Mati, that you unmuted yourself. Do you want to introduce yourself and share a little bit?
Thank you so much. I'm Mati Hlatshwayo Davis, and I'm on faculty in the Infectious Diseases Division in the Department of Medicine, and also have a faculty appointment at the John Cochrane VA Medical Center. I'll be very transparent that I was a clinician prior to the pandemic. I actually was pregnant at the beginning of the pandemic and had my pandemic baby in May. 2 weeks later, George Floyd was murdered, and everything changed for me at that point. And advocacy and community engagement has become central to my mission and to my career goals. As it has, quite frankly, for a lot of Black and Brown men and women across the country. For me, what was startling about this was the truly devastating statistics around the disproportionate impact this was having in communities of color, both nationally and globally. My intersectionality also sees me as an immigrant from Zimbabwe. So that was particularly important as well. And I'll be honest, very frustrating, the kind of response, the sort of, shock and awe around these statistics, because COVID-19, quite frankly, joins a long list of other conditions in medicine. Dr. Punch can attest to this, that we see this in, right? So it speaks not to the disease state itself, not to the individual genetics, but to the barriers and systemic and institutional racism that makes it impossible for most of these populations to access care. So this year has really been about using my platforms and to bring about education and advocacy for my community and communities like mine that have been so disproportionately affected. I am now on the Board of Health for the city of St. Louis, and I think they're tired of me because they know what's going to happen about, I give them about a good 10 minutes at the beginning of each meeting to then say, hey, what are we doing around health equity, around equity and access? And there's two things I just wanted to start this conversation with, which is there was a lot of talk about vaccine hesitancy in Black and Brown communities, which is valid, right? We know that historically, dating back to slavery and all groups of color in this nation, there have been abhorrent occurrences that have lost the trust of these communities. We know that that has impacted their desire to access the very institutions that should be caring for them. And we know that that has also meant that there has been very low attendance in clinical trials. However, and let me be clear, vaccine hesitancy is not the only story here. There is a clear access issue, and that this is what has become very clear in vaccines. The data so far nationally and within Missouri and within our cities, and within our region, I beg your pardon, has been that we are not vaccinating people of color enough. And again, people hide behind vaccine hesitancy. Oh, they don't want the vaccine. Well, I challenge that. In the communities I work in, there are very many people who do want this vaccine and for whom access is a challenge. I thank Dr. Schmidt for bringing up all of the efforts that the county is doing. And I'm proud to say that the city has really challenged themselves here. In collaboration with its partners, it's administered over 11,000 doses of the vaccine. Of those, 40% have received their first and second dose. And there has been specific areas of focus here. The first is using zip code level and race ethnicity data to identify and focus on areas in proportion and populations disproportionately affected. The second has been ensuring access to vaccination sites by working with transportation service providers, also holding and scheduling community vaccination clinics in communities most severely impacted. And here we're looking at North City and South City specifically, and then working closely with public and private community partners. Communities of faith, academic institutions, federally qualified health centers, the St. Louis Affordable Housing Authority, and the St. Louis Department of Health Services, as well as the City of St. Louis Emergency Management Agency. It's my belief that we're not going to manufacture this trust out of thin air, suddenly at the tail end of many, many decades of it. But what we can do is put our community partners who have earned the trust of these communities to the fore. And I'm just really proud to see both the county and the city doing that under the leadership of folks like Dr. Garza and other people across our region. So I'll stop here and let the conversation continue.
And the strength of your voice. I mean, there's one, my colleague April is in the chat, really thanking you for naming racism at the root, but also giving that very strong fact-based, here's what we're doing to address these things. And I'm very glad you're on the board of the health department. Dr. Punch, we called your name. Get in here and kind of any messages that you want to provide as we open up.
Yeah, I appreciate that intro. What Mate is describing is very much been my experience. I'm a trauma surgeon by training, and I say now I practice community health. I am the founder of the T community of health that's working to reduce the impact of trauma in the St. Louis region. And it turns out that bullets and viruses have a lot in common. And I've certainly gone all in since the hit of the pandemic to really bring everything that I learned over the last 2 decades from violence and apply it to what was going on in our community around the issue of the viral pandemic. And one of the things that has been just the privilege of my career, quite honestly. I mean, if I'm just really honest, one of the most incredible things has been to be in the Regional Health Commission. It's the Integrated Health Network, the Community Health Workers Coalition, Alive and Well Communities, and some really exciting new partnerships that have arisen more lately with the BJC and SSM. And it's just really been neat to be a physician who gets to listen to these like ridiculously intelligent and very clear and passionate leaders in the community, and many of whom, almost all of whom, quite honestly, have been in the inner group, Black folks. And I've never, as a physician, had a home to practice that was that safe. And so this sort of truth to power has come together for me in seeing what it means when we center, and as Jason Purnell says, asymmetrically invest in correcting the burdens that are created by structural and systemic racism. So what I've seen in that work is, first of all, a step before the step before the step, which is, what are we even going to say to our community in this next era of COVID that includes the option for a vaccine, which is literally the embodiment of medical racial trauma. It's like, you might as well have just said, okay, here it is. You have this thing that could potentially, from a public health, 40,000 feet perspective, right? Totally save lives. And yet it represents horror in Black bodies. What do you do? How do you bridge that gap? So to be part of that conversation with these community leaders who are just woke beyond woke, it has been a thrill. And what has come from that, right? And what has rejuvenated, honestly, my faith in medicine is my return to the medical ethic of autonomy, that there's nothing wrong, and it will never be wrong, to support someone to make a choice about their bodies. And that the best thing that we can do is to make that sure that choice is an informed choice. So that body of work to make sure we're getting out, boots on the ground, talking to people, Zoom, in person, flyers, masks, whatever it takes, so that we give people the opportunity to ask the questions they want to ask and know what they need to know to be well. And then also to frame it in a larger context that really this is about immune health, right? The vaccine is about immune health. And if you choose or don't choose to make the vaccine be part of your immune health, it doesn't mean you can't have immune health. And so it's been fun to kind of really start digging in with people around eating, sleeping, food, exposures, environment, stress management, even breath work, and getting our fight and flight response under control so that it's not flooding our bodies with cortisol. These conversations, again, bring me back to my trauma. It's all the same thing. So it really, really hopeful that the lessons we're learning right now about what it means to take care of people of color will flood into all these other issues that where we know it's equally relevant.
Wow. You give me hope. And you also, I think about kind of this definition of an anti-oppressive process that really kind of is the foundation for a vaccine rollout that has information and opportunities to ask questions and make choices, true choices, as opposed to pressuring and shaming people. That's an amazing gift. I know we're going to run out of time, like in one instant. So Lisa Clancy, get in here a little bit so that we can introduce yourself and hear your voice in this conversation. And then I'm going to go to some issues related to effectiveness and also some potential myths around people jumping the line. But go ahead, Lisa. First, you go ahead.
Good afternoon. I'm Lisa Clancy, St. Louis County Councilwoman from the 5th District, which is Eastern Central St. Louis County. No one likes to follow Dr. LJ Punch, but I guess it's going to have to be me today. I am honored to be back here speaking with some folks that I admire, and especially at my alma mater, the Brown School. I saw some snaps from the other panelists when LJ was talking about informing people and providing good information about this vaccine. I was talking to a friend of mine who works at the Regional Health Commission the other day, and we were talking about just that. Framing this from you have to get the vaccine to helping people make it to informed consent, I think is the phrase she used. So people have the right data and information to make the choice that they need to make for themselves and for their family. And I think that ties into a lot of equity issues that Dr. Mati helped to highlight, and also it brings me back to how important the work that our public health departments is doing in this region, whether it's the city or the county. And one of the things that I feel like I have been a little outspoken about recently in St. Louis County is making sure that not only our health department has the resources it needs on a large level for things that extend even beyond coronavirus, but also resources now getting the vaccines to the county health departments. I mean, obviously there are other healthcare providers, hospitals that need vaccines too, but what I've really come to understand and appreciate during my time in county government is how much our public health department is the safety net for the uninsured and underinsured in our region. And so it is so key that they have the resources that they need to be able to keep people healthy and well. You know, not just vaccinating people, but also doing the community outreach that's needed. I mean, there's incredible infrastructure that they have to do that, but, you know, let's kick that up a notch, and that's only going to happen if they get more funding. So that's a little bit more of a longer term thing, but I think generally our county health department has been a leader in our region when it comes to navigating coronavirus and the vaccinations. We have done a pretty good job of standing up infrastructure in a very short period of time without a how-to manual, with limited support and resources from the state. You know, and the good and the bad news is we still are in a pandemic. The good news is I think we're getting better and smarter at navigating it, and we'll continue to do so.
So I'm going to move us into kind of one more discussion. We don't have to go in any particular order, but there's a couple of things coming up in the chat, and then Cynthia, I'll actually call you back so that you can help with some of the chat questions. So there's some misunderstanding about if I've had COVID, do I need a vaccine? If I'm vaccinated, do I have any risk for myself or others? It's pretty atypical for average citizens to know Moderna's name and Pfizer's name and efficacy data coming out of trials. And so we're trying to sort through the effectiveness of the vaccine, how we understand whether we have had COVID, do we need it? Can I get vaccinated and then go be with my loved ones that I'm just dying to do? So talk us through a little bit of some of those issues or other things that you've heard from your sphere that you want to use this platform to make sure that you say.
Who do you want to have tackle that, Mary? Anybody?
I nominate Alex.
Sure.
Go
yeah,
ahead.
well, I was going to nominate Dr. Mati, so
Yeah.
I'll tackle one and then you grab the other one. Okay. So as far as gosh, and now I've lost track of what the questions were. If you've had an infection, COVID-19,
that's right.
Should you get immunized? And the answer to that is yes. And the reason for that is we still don't know enough about how much immunity is imparted on somebody from the natural infection. Getting the immunization, of course, is always going to be beneficial. to improving that immunity status. And so even though if somebody has had infection with COVID-19 in the past, it is still recommended that those persons receive the vaccine as well. Now, there is some debate about whether, particularly with the mRNA vaccines, whether you need to get both doses or just one is enough. And I think that's still a question mark. So nobody has landed on that yet, but that's still out there. So that's sort of the answer about COVID-19 natural infection and vaccine.
Good.
And so, having had the baton passed on, I would say, I was looking at an amazing statistic today. Last year, around this time, we had 200 deaths from influenza in children. This year, can you venture a guess how many? 1.
Yeah, I was going to guess 0.
Really?
And I think it's important. I think we have all been glued to our TV, glued to Twitter and social media, glued to the CDC's website, that we started to ruminate on very specific things, that we sort of lose the big picture. So that's what I try to do. I try to leave now every at least 10 minutes at the end of all my patient encounters, whether in the hospital or in my clinic, to just say, hey, what questions do you have around the vaccine and what do you want to do? And I want to echo what Dr. Punch said. Most of the feedback that I've gotten as someone who takes care of COVID patients and other people with infectious diseases is, we're tired of the coercion and we're tired of the scare tactics. Stop telling me what I need to do. Stop telling me I'm going to die. And so I encourage anyone on this call who has access to these communities and who's doing this work, I have a few things that I like to impart, and one of them is to personalize it. Sure, I'm a physician and a public health expert, but I'm a mom. I'm someone's wife, I'm someone's daughter, right? I'm just a member of this community who has a lot of the same struggles, and I had to make a decision about taking the vaccine. So a lot of times I use my personal journey with the facts and figures to help people make an informed decision. So in moving forward about, why do we need to wear masks after that? Well, these trials, these phase 3 clinical trials, which, by the way, let's just cover one thing here. The numbers for these trials, because now we're like pitting Pfizer versus Moderna versus Johnson & Johnson. The flu vaccine, again, 50 to 60% on a good year, right? And look at the dramatic impact it's had on disease burden and on death globally. In the US, that number I just gave you, 200 last year, 1 this year in children deaths. So you then take vaccines that have much higher efficacy, all 3. And the question shouldn't be, which one should I take? If you've decided that this is the right choice for you, whichever one is available is going to be the best for you. So nitpicking between those numbers, not necessary, but I understand it, because what else have we had to do but sit on our couches at home on lockdown and obsess about everything, right? So then we come to those phase 3 clinical trials, and they were not designed to look at what happens with asymptomatic spread, meaning people who get COVID without symptoms. They were designed to be able to tell what is the impact on folks who do get COVID and are symptomatic, or on death, but not asymptomatic spread. So the reason we say you still need to mask is because although we have a good guess, and we know through biology and science and what the clinical trials tell us, we cannot say definitively that these COVID vaccines have the same impact on asymptomatic spread, hence the need for masks. And quite frankly, given that statistic I gave you around flu, a lot of people ask me, where do we go from here? And I stopped saying back to our new, back to normal. I think there's a new normal here, and a lot of culture shifts that we're going to see. And a lot of those is seeing the great impact that masks have.
Terrific. So Spring, go ahead, and then I may come back to kind of a coordinated government response or unalignment. And so, but go ahead, Spring.
Oh yeah, I would like to skip that one if that's okay. So I just wanted to, I wanted to follow up a little bit, because one of the things that's also true in here that has been so difficult to do in communication is that it's almost impossible for me to represent how much I don't know. I'm a researcher at heart. Every public health issue up until January 2020 that I had ever touched, I had deeply researched. I had spent hours sort of poring over like the available evidence. I talked to community members. We did community listening sessions and voice discussions to talk about the impacts in our community. I have to tell you, I don't know the answer about whether or not we're going to receive a booster shot will be necessary. I don't know the answer on whether or not like one of these is better for you, or whether asymptomatic transmission is possible if you get the vaccine or if you've had COVID previously. None of us know the answer to that yet. There are some reasonable suppositions that we're making sort of based on some of the data that is currently available. And that is the most scientific, you clearly don't know the answer to that topic. But we also, it is hard to say what we know at any given time, know that this will be changing because this is entirely new to all of us. It's entirely new virus that we are experiencing in real time. Everyone is trying to give the best advice that we can. And sometimes new information comes out that changes everything, or changes something that feels very crucial to people as we move forward. I feel very much like we do need to have an open opportunity that we're offering to community members, allow community members to make the choices, be prepared to debate and defend what I do know at any given time for people who should ask me questions about what it is I am about to potentially recommend for their body and their health. But also, everyone also has to be comfortable with the idea that I don't know the answer to that yet. And neither does anyone else. So we are, to Dr. Bhatti's point, we are avoiding a substantial amount of risk. And there is good safety data that we can back that up with, and we can feel good about that. But I don't have some of the deep dive on some of the answers, and we have to be able to say that too.
So I'm going to see if I can get Dr. Punch your voice in here, because I think that myself as a leader, trying to kind of convey emerging scientific information, trying to plan in the face of lots of ambiguity and uncertainty, very complicated. So are there, what advice do you give to others that are trying to sort through all of these messages about how to do that, who to trust? What is trustworthy communication look like in the communities that we are talking about? Any words of wisdom, because you're in the chat and I want to hear your voice.
Dr. McKay, you set me up for a softball on that one, because that is exactly what I'm 1000% focusing on. As a trauma surgeon, I frequently have met people on the worst days of their life in which they have to make life and death decisions, even as a general surgeon, life and death decisions without enough information. They have to choose these crazy interventions or not. They have to consent to something that's just unimaginable, total unknown. What I've learned to do when people have to make those kinds of decisions is slow down and listen and try to hear and tweeze out, of all the things we're thinking about, what matters to you most. I've made that the center point of how I'm now talking to communities about choice and perspective, because when you center, right, what matters to someone most, you're doing two really radical things, right? You're listening, which means you're present and you're it's sort of anti-trauma, right? And then you're also giving back that power, which is exactly what the problem is when it comes to coercion and feeling unsafe and not knowing what to trust. You can trust yourself. And then what we can do, right? We can do is we can supercharge. Well, okay, if this is what you're saying, let's think about the pros and cons of the choices. If you say what matters to you most, that you do not want to infect your 22-year-old who lives in the house with you, who is immunocompromised and is going through chemotherapy. Okay, then maybe you have a different set of thought processes about your risks and benefits than somebody who has been able to, shelter at home and has minimal exposures and is robust and very, very healthy on their own. So these are the kinds of things that I think have helped elevate the conversation. And it's been fascinating to hear the clarity that people can get when they turn the question around from should I do it, should I not do it, to what matters to me most.
That's awesome. I didn't mean to set you up so well, but I knew you could handle, that question. So I'm gonna just ask a tough question around, there's clear guidance that our systems are following around who first, who next. But then there's also kind of these kind of wondering about, sure, there's guidance, and then there's all kinds of side doors. or are there side doors? And so how do we kind of think about sticking with state guidance? Is there alignment between our region and our state? How's that all working in terms of collaboration? And then what's the kind of commitment to kind of, rolling out across the guidelines versus, opening side doors? If we can tackle some of those hard issues, because particularly those rumors around side doors, or it kind of diminishes trust. And so anything that you want to say around our challenge following guidance, collaborating, with our kind of state and local officials, and then kind of anything that you could do to kind of, talk about the rationality of this or the kind of lack of control we have over it. I think that people really do want to know some of that in the chat. Yeah.
Sure. So Mary, I'll just offer a few comments, and
Please.
I think, as you know, I got to jump off here in a little bit. I think it's important for people to understand sort of how the guidelines get developed around vaccine. And again, you heard me mention about a scarce resource. So it's a scarce resource. So the CDC, the Advisory Committee for Immunization Practices, is really sort of the bedrock of vaccine allocation. But then it gets distributed down to the states. And so when I say distributed, I mean that information is then given to the states to make their own choices on how then they want to distribute vaccine, which is how the state, just talking about the state of Missouri now, developed their program on vaccine distribution. So I will preface it by saying, it is a difficult and complex issue. And for any group that gets prioritized rather than another, there's cogent arguments on every side on who should be given access to a scarce resource first. And so it's difficult to say with any sort of absolute clarity, this is absolutely the right way to go, because I don't believe there's an absolute right way to go. I think that we make our best estimates. We try and develop what risk is, and then move out accordingly. You could make an argument, and I've heard people make this argument, that healthcare workers should not have gone first because it's obvious that we have all the PPE and we can protect ourselves. Now, whether that's a rational debate or not, that's again up to different people's points of view. But I do think that it comes down to who is at highest risk. So when we think about it, we're thinking who's at highest risk for either exposure or a poor outcome, right? And so those are two really guiding principles. So as we've worked through the different state phases, as they've come to be known, and we're always, because we're an urban area and we have so many people that are in these phases, we're always a little bit, not behind, but we have more work to do. And so with this opening of this new tier, this tier 3, this isn't a value statement on who deserves vaccine and who does not. It is who is most at risk to have a poor outcome and who's most at risk to die from a COVID-19 infection. And clearly that is, the elderly. We know this from looking at our data, people with chronic medical conditions. And then I also will throw in there the equity question. We know that African American and Hispanic communities take on a larger burden as well. And so before we can start thinking about moving away from those at-risk populations, I feel like we need to be relatively comfortable that we've addressed those high-risk populations that we know are going to have a poor outcome. And so, people like to spin that as, well, you're not going to follow the state's guidelines. No, we are actually, but we are putting our emphasis on those high priority risk areas until we can get to the point where supply meets demand. So I'll just stop there, but I do feel like that's an important point to make.
I'm glad that you're one of the people that I see on TV, because that was actually the clearest answer behind the guidelines. And I'm paying pretty close attention to this. And so I really, really appreciate that clarity around what are the principles underneath those guidelines that you're trying to follow and why they make important sense to you. Yeah. Go ahead, Lisa. Yeah.
Yeah, if I may jump in here, as someone who is in regular contact with community members who are wanting to get vaccinated, and I get a lot of questions about, where to go and how and who's eligible. I think one of the things that I've noticed is jarring to people, there's just so much to be said here about the systems theory behind all of this, but you've got the feds creating some guidelines, then the states get to create some guidelines, then local jurisdictions get to implement. But there's been some unevenness in terms of priorities between states. And so, for example, one of the things that I've heard from a lot from people that the council actually stood together to take action on is about getting teachers and school personnel vaccinated, because there's about 30 states in the country that have moved teachers up the priority list given their contact with students, but also I think as a way to acknowledge that parents want their kids back in school, and parents feel safer putting their kids back in school when they know that school personnel, teachers, and others are vaccinated. And so, Missouri was an outlier. We're one of those not 30 states that has prioritized teachers. Teachers, I think, are in the next tier of critical infrastructure that the governor announced earlier this week, will be eligible on March 15th, I believe. And I think he didn't move teachers up in the priority list, but I do think it was some peace of mind for people to at least know when teachers and other critical infrastructure workers would get vaccinated, because again, there's lots of anxiety about just when. And hopefully, the Biden administration, with the news that they announced yesterday, that they feel pretty confident about the availability of vaccines. I think by May, most people who want to get a vaccine will be able to, will be helpful for people as well.
So we've raised Biden. You said President Biden's name, and and at the same moment, a question came in around the messages that we're getting at the federal level about when all adults will have access to the vaccine, which could be much earlier than anticipated. So if somebody could kind of tackle, do you think President Biden is right around this kind of May 30 deadline? Are you still absorbing that? Tell us the truth if you think he's messaging hope, but maybe is off by a few months. And then I'm going to go to talk about our friends in Texas relative to masking. But first, Dr. Garza, is up to you.
Sure. Yeah. So this will be my final comment. So I was born and raised in Missouri, and so you got to show me. But I do believe that President Biden is making a good faith sort of announcement there. And the reason why I say that is a couple of things. We know that Moderna and Pfizer are going to be able to ramp up production. And so the estimates that I heard was beginning of April, we'll start seeing an increased supply. So they have been, and you got to remember, they're learning as they're going too, like completely new vaccine. It's amazing, really, a feat of science that's been accomplished in all of this. So they've been improving their vaccination or their vaccine production capabilities, all those things. It usually takes about 110 days to go from scratch to vaccine. And they think they can cut that down to 60 days now. And so that's incredible. The announcement of J&J coming on board, and then the contract with Merck to start manufacturing vaccine as well. Another vaccine that's going to be available. And they're thinking that production will increase around the April-May timeframe. So I think fairly soon that those floodgates will open up, and then all of a sudden it will not be a supply issue, but more of a demand issue, and making sure we have enough people to be able to get vaccine out into the population. So I am hopeful, but as all of you know who have been in this pandemic has a weird way of jogging right and then jogging left, and right when we think we're safe, it has its own ideas. So the virus gets to play too. So we can never lose sight of that.
Yeah. Well, with that, I know that you have to leave for another meeting. The white coat in back of you might as well be a superhero cape. Thank you for all that you're doing. And we really, really appreciate your leadership. And we're going to continue the conversation and do good in your absence. So thank you, Dr. Garza, for joining us.
Thank you. Take care.
Thanks. So can I share with our panelists that within, an hour, the same hour yesterday, I got information about the importance of emphasizing not only wearing your mask, but potentially double masking. And also that Texas has decided that you don't need a mask at all. And so that whiplash effect around what's our state doing, what should I be doing, help us to sort through your best advice that you would do for your loved ones around some of this during the time that we find ourselves in, with which is hope, but also pretty significant risk still. How do I sort through all this? Go ahead, Dr. Maddie.
I'll start. We were very fortunate to have Dr. Fauci, who I will always consider to be my ultimate boss as an infectious diseases physician, and who, quite frankly, has led us with such integrity since the beginning of this pandemic. And one of the questions we asked them at that grand rounds was, he was comparing how this pandemic fared compared to the HIV epidemic when it first hit here. And he said something that I think was really profound. And he said that the one thing that he's noticed is that the way that we've politicized this pandemic and what it's meant about where people access their information and who they believe their trusted messengers to be is something that he thinks is very unique. Not to say that the HIV epidemic didn't have its own challenges, no, but to say that what's happened here and, around the election and around the corners that it made some segments of the population feel like they needed to go to for their information has been disappointing, to say the least. So I thought about that yesterday when I started getting texts and calls and DMs from, folks in Texas asking for my thoughts and my advice around this. And so I can only speak to myself, for myself, and for myself, I say this, that there are trusted messengers who have dedicated their careers and their lives to science at its core. And I say this gently because I had to check myself from saying trust science earlier in this pandemic, when that is really offensive to communities that, again, have suffered at the hands of those that were supposed to be trusted messengers in science, right? But I do have a position of privilege in having studied this myself, being able to critically look at data and understand, what has happened. And so for me, that has developed my own comfort level with who I go to during these times. And those folks, and the data speaks clearly, we are not in the clear yet. Masks have saved millions and will continue to until we get anywhere close to a degree of herd immunity. And so my message and I stand in solidarity with the people of Texas and say, continue to do the things that public health experts who have dedicated to this work have encouraged, including, it's a toolbox. The vaccine isn't the lone tool that's going to save the day. Neither is masking alone. It's a combination of these things. A vaccine, if that is the best decision for you and your family, masking, social distancing, washing hands, all of it goes into play. But I certainly do not believe, with the information we have available now, that is a responsible decision for any of our states at this time.
Really, really clear. So as I promised you, panel, we are almost out of time. We're in our last 10 minutes. Did this not go by like the speed of light, right? So I'm going to give you each the last word around making sure, from your vantage point, you want to either get a message to I can tell people are really paying attention in the chat, message that you want to deliver, or hope for what we're going to learn from this experience that we don't have to relearn again in another format because we didn't pay attention seriously to what we learn and know. And so last words. Who wants to formulate one and go first? Go ahead, Spring.
So I'm going to cheat a little bit because two real quick. One is that it is true that they have also a lot of the state's architecture and many other states deprioritized public health in the rollout of vaccine. And so they deprioritized investment in resources and vaccine in public health departments to be able to do that. And that often has meant, and it certainly has meant here, that they deprioritized those that the public health department is most likely to serve. And we do see the consequences of that. I very much know where our priorities are. And we work to serve in that space. But the resource vein is limited in that. And then I just want to say, from what I've learned and what I hope we've all learned, I just want to capitalize on something Dr. Mati said. What a lot of us learned from the HIV epidemic is that condoms protect you from a lot of things, not just HIV. And it's a public health win for the number of people that utilize condoms for a wide variety of reasons as a standard precautionary protection. And while there are people who don't, there are people who wouldn't think of going without one, or some other form of reproductive protection, in however you choose to use that. And so it is critically important that we think about these things that we do to protect ourselves. A mask is likely to continue to protect you from flu. A mask is likely to continue to protect you from a wide variety of publicly transmittable, communicable diseases. It's not a bad idea ever.
Thank you. Thank you. Lisa, Dr. Punch, you want to go next? Final thoughts?
I'll piggyback off of something that Spring just said. I mean, this has been sort of my main takeaway over the past year or so. Not that it wasn't a priority before, but it is even more so now. And that is 3 words: fund public health. I mean, public health is everything. And I'm concerned that, as Spring said, we've deprioritized it. It's become too political. And, I hope coming out of this, we'll see some stronger investments in our public health systems, both locally and beyond. And I hope, I don't know that I have the answer to this, Dr. McKay, but there are a lot of lessons to be learned from this. I hope that there is some sort of documentation happening somewhere about these lessons learned so that we can draw from this the next time we have to go through a public health crisis, a pandemic of this scale, because it appears it will probably happen again, as it did this time, So it is very important that we are taking these lessons learned so that we don't have to recreate things again like we had to. So thank you.
Thank you. Thank you.
Just hearkening back to the issue of mask wearing, it really brings home to me one of the most pressing issues this pandemic has revealed, which is the tension between personal responsibility or personal choice and personal responsibility to the greater communal well-being, and how poorly we navigate that tension. And to me, one of the most powerful unspoken forces that makes it so difficult for us to connect personal choice to communal well-being is racism itself. And I really am hoping that what we're learning and the work we're having to do in this pandemic brings down that wall by showing it for the fallacy that it is. Because the truth is, they need not be mutually exclusive. And I think mask wearing is one of the most poetic expressions of what it means to think about the role that you have in assuring the health and well-being of your neighbor. So it's sad and it's hard, but I think it's to see some of the things we're seeing, but I think this is a necessary pathway for us moving forward. And again, I just appreciate the chance to share with this incredible group of people on this topic.
Thank you. Thank you. Thank you, Dr. Mon.
Dr. Punch, every time, man, right here. I'm just honored to have access to you and your wisdom and your leadership. Our region, I just can't say enough. But I guess I want to close with just a little bit about community. This year has been hard. It has pushed us. We are all a little more damaged. We are all tired. And there were points in this where I was so disappointed by the sort of Hunger Games approach to access to vaccines, to care. everyone here, all of us have been put in an impossible situation, but I have been so encouraged by the community that has allowed me to thrive and allowed me to stay healthy. People that sent a text, people that checked in, people that could tell that I was struggling, people that knew I had had a baby in this and wanted to uplift. And I just encourage that we keep that essence. It's very easy to get frustrated when you see that person get over you, when you see that district has access and you don't. And it's easy to see the issues. And I was one of those people prior to being very privileged to be privy to some of the conversations behind the scenes to criticize and to think that nobody is working. But to now get to know some of the people on this panel, Dr. Garza, and some of the work that's being done in our county and city health departments, people are working for you. People are trying, a lot of times with their hands behind their back. It's hard to do things when you don't have the product. We need more vaccines, and that has to be ramped up. In the meantime, let's support each other. Let's look for the good. Let's celebrate each other. And let's try to stay safe. But I'm grateful, and I want to end on a note of gratitude for community, for the leaders, Dr. Schmidt, Lisa, Dr. Punch, Dr. Fred Eccles, and all the other people, Dr. Garza, and all the other people in our region for their leadership in getting us where we are today. A year ago, I would have never thought that we would have the advancements that we have now. Never could you have told me we would have a vaccine, let alone as many in circulation. Never would I have thought that we would have this type of movement. There's a lot to be grateful for, and let's be kind to ourselves and to each other.
And so let me then just say what I said to Dr. Garza, to all of you, whether there's a white coat in back of you or just a superhero cape, to try to lead with your values, integrated with science, integrated and with really seeing human beings as opposed to a task to be done. I think you are an example of that as really public, community connected, value driven leaders. And I'm grateful to have been able to spend an hour with you and really pretty much in awe. The second thing that I want to say, because my background actually is in mental health and emotional wellness. And so I want to emphasize what you said is that we may have gotten through this, but there's going to be consequences as we come out of that. We are going to need supportive communities to transition to whatever is next. And we're going to need extra support to really come to grips with what we've been through this last year. So what I want to say is that community, Dr. Mate, it can't give up on us as we kind of move forward in this. It's got to stay strong and collaborative and supportive and connected. And there's a lot of forces that try to splinter us, but I have encountered amazing human beings in this process that are protecting, themselves, their loved ones, their communities, and your voice, all of your voice, is truly extraordinary. So with that, I want to thank our audience. There is more comments in the chat than Cynthia Williams can keep up with, and I want to really thank Janet Williams, Janet Gillow, Cynthia Williams, and all our panelists. Thank you. Don't give up. Don't let up. Come back here for sources of support and community if we can be of help as you're on their journey. Thank you so much. Take care all. Thank you very, very much.